Hello, folks. Welcome to today's podcast from Brain Network. Today's guest is Dr. Clemens Nyadro of University of Ghana Medical School. The topic under discussion is leukemia, a disease that plagues many people all over the world. Now, without wasting much time, let's dive right in. So, Dr. Clemens, can you provide a brief overview of what leukemia is?
Thank you very much, Eric, and thanks for having me on your show. So basically, I think this is a very important topic we're about to discuss here. And I'm first of all going to start by explaining what cancer is. So basically, cancer would refer to a broad term used to describe a group of diseases characterized by uncontrolled growth and spread of abnormal cells in the body. So as our body is made up of cells, now these cells multiply and grow. Now if there's an abnormal growth of these cells, we term that as cancer. Now going back to your question, leukemia is also a type of cancer that affects mainly the blood and also the bone marrow. So you already know our body has the blood system, okay, and also we have the bone marrow. So when there is abnormal growth of white cells, that's the white blood cells, we could term that as leukemia. Now basically, leukemia has different types, okay. There are different types of leukemia, and currently it's one of the most common cancers in the UK. All right, according to the cancer research, there's about 9,900 new cases of leukemia each year, and also it accounts for 3% of all the cancer cases in the UK.
All right, so you rightly mentioned that leukemia has different types. Can you tell us about some of these types?
Very well. So broadly, we have 4 classes of leukemia currently. The first type is what we call the acute lymphoblastic leukemia, and this type of leukemia progresses rapidly, affecting your lymphoid cells. So the lymphoid cells is also a type of white blood cell, as I mentioned earlier, and it is most commonly seen in children, although some can be present in adults as well. The second type of leukemia is what we call the chronic lymphocytic leukemia, which is the CLL. And now this is just an opposite of the acute lymphomia. It's rather progresses slowly after affecting your primary lymphocytes. So the lymphocytes is also another group of white blood cells. Now this is commonly diagnosed in adults, okay, and tends to progress slowly over the years. Now the third class of leukemia is what we call the acute myeloid leukemia, ALM, and it's a fast-growing leukemia that affects your myeloid cells, which is also a type of the white blood cells. So these white blood cells, the function they play is they fight infections within the body, and it can occur in both children and adults, and this actually requires prompt medical treatment because of its severity. And the last type of leukemia that we've discovered is what we call the chronic myeloid leukemia, CML. Now it progresses slowly from the start, but it can actually accelerate over time, and it affects your myeloid cells, and this is typically related to adults because most of the cases diagnosed is in adults. So these are the type of leukemia that we have currently.
All right, thank you for that. So these are very big names, and it will be difficult for people to assimilate as quickly as you said them. But all these types may have common characteristics and how they start. So how does it start from the beginning? Can you explain exactly how the processes, or someone will say pathophysiology of these disease, how it starts and the prognosis?
All right, thank you very much. So I know the terms might be quite big, but I'll try to break them down so our audience can actually understand these types of leukemia. So first of all, to start with the acute lymphoblastic leukemia, which is the ALL for short. This actually is common in children, like I said earlier on, and it starts with a rapid onset, and the symptoms also progresses slowly. Now, with the acute lymphoblastic leukemia, there are certain symptoms associated with it, which helps us to characterize, this kind of or this type of leukemia. The first one has to do with fever, so that's increase in the body temperature of the victims. We also have bone pain sometimes, and also swollen lymph nodes. There could also be fatigue in some certain cases. Then you can have infrequent or frequent infections, so continual infections in the victims. Now, to talk about chronic lymphocytic leukemia, which is the CLL, like I said earlier on, it's primarily, it primarily affects adults, okay, and it has a slow progression, okay, and normally it's asymptomatic, so you might not see certain symptoms unless you do a detailed diagnosis. And with this type of leukemia, you would also have weight loss in the victims. You also have recurrent infections, so repeated infections, and sometimes your spleen becomes enlarged, okay, and by extension your liver also gets enlarged. Then you also have fatigue over time. Now, it's actually due to accumulation of mature but abnormal lymphocytes, which typically are called the B cells, in the blood or bone marrow. And sometimes we've also discovered some in your lymphoid tissues. So the third type, which is the acute myeloid leukemia, which is the AML, it occurs in both, children and adults. That's what we've seen over time. And the average or the median age for diagnosis is around 68. So people within the age bracket of 68 or below can get affected by this AML. Now, we see it has a rapid onset, and also the progression is rather very, very slow. Now, some of the symptoms you might see typically displayed in acute myeloid leukemia is fatigue, which is actually common for all the three types that we've discussed. You also have fever, setting in. Then you might have bleeding in some cases. Then frequent infections also do occur. Then your liver or spleen becomes enlarged. Then you typically be feeling bone pains. So most of these bone pains could be attributed to cancer. Now, the last type, which is the chronic myeloid leukemia, normally we've diagnosed this in adults, and some of the symptoms includes abdominal discomfort. We know some of the abdominal discomfort could be due to food poisoning or foodborne diseases, right? But sometimes you have chronic myeloid leukemia being the primary cause of that. You also have enlarged spleen or liver. Then one unique characteristics with the chronic myeloid leukemia is that you normally sweat a lot at night. So these are some of the characteristics of the four major types of leukemia that we've discussed so far.
Thank you very much. Sounds like a lot going on in the body of someone with leukemia. You've mentioned very serious signs and symptoms of this disease, and I wouldn't like to scare listeners, but I'm thinking apart from fever, abdominal pains, there will be some nausea, vomiting sometimes, and other signs and symptoms. And so going forward, it means that this is going to impact negatively on people's lives, obviously, because if you're having these symptoms, it will be difficult for you to carry on with your daily life, be it professionally or life at home. So, are there any treatment options for this disease? Is there hope for people living with leukemia?
Certainly, there's hope for people living with leukemia. Currently, we have what we call the chemotherapy. Chemotherapy basically means you are using powerful drugs to kill the cancer cells or to stop them from growing or divide, like I said earlier, on abnormal growth of cells, right? So chemotherapy is one of the effective treatments for typically acute leukemias, right? Now, what happens is that it could be given, orally or intravenously or through injections. That's what we normally do in clinical settings. We can also have immunotherapy. So we have some classes of drugs which are, given during, the course of leukemia. And basically, it helps to recognize and attack cancer cells. That's the main mode of, action. And normally, it would help you generate monoclonal antibodies to, attack or treat these cancer cells. Now, there's still ongoing research when it comes to another, form of treatment option, which is stem cell transplantation, which is quite expensive. And in this, we're trying to replacing, the dead or damaged cells with, healthy stem cell from donors. Okay, and this also is an effective means of treating cancer, but quite expensive. Then a common treatment option, which most people resort to, is the use of radiation, which we'll typically call the radiation therapy. So we're just using high energy, to target and destroy the leukemia cells. Now, basically, it would be targeting, certain aspects of the system, maybe looking at the lymphoblastic or the lymphomia, and also we could also look at aspect where it spreads to the central nervous system. Then in some cases we've used biological therapy, where we've looked chemical messengers like what we call the interferons or interleukins, which are substances which are produced by the body to stimulate the immune system or interfere with the growth of cancer cells. So trying to block the cancer cells from multiplying or growing abnormally. So basically, these are the available treatment options for cancer at the moment.
Whoa, that's a lot. Yes, but what comes to mind is the accessibility of these treatment options to people, especially those in developing countries like our country, Ghana. So are these treatment options available, and at what cost? Because one of the stumbling blocks of healthcare in Ghana is funding, people being able to fund their healthcare. So in this case, is there hope for those in Ghana who are suffering from this disease? And as far as treatment is concerned, are people benefiting from some kind of treatment?
All right, thank you very much for this. When it comes to developing countries like Ghana, there's certainly a gap in terms of treatment, or let me say healthcare facilities or infrastructure. And that also extends to, leukemia, as we've discussed. Now, currently, there are limited facilities available for treatment of leukemia in Ghana. This is primarily due to the high cost of treatment. Even though radiotherapy seems to be a common thing, which a common treatment option that is available, areas like the stem cell implantation is still not available in back in Africa or in Ghana, to be specific. And also we don't have a lot of equipment which could actually help in providing chemotherapy at the highest level, as compared to developed countries like the UK, where chemotherapy equipment are available to help in treatment. So I would say that on the larger scale, we still have a huge gap when it comes to cancer treatment in the country, specifically Ghana. And this is primarily due to the exorbitant cost or the high cost associated with treating or dealing with cancer cases.
Whoa, I see. So it means if a poor man gets leukemia, it's virtually a death sentence. I hope there will be something that will be done about this. And well, I've just saved the good for the last. Now, we've been talking about this disease for a while now. Is so someone may ask, all these things you're talking about, what's my lifestyle's contribution to this disease? Am I doing something that's predisposing me to it, or was I born to get this disease? So as far as we talk about disease causation, we have to send our minds to either it being hereditary or lifestyle related. So are there things that we do that predispose us, or if we are born into a family that has had this disease, could we also get it?
All right. Thank you very much, Eric, for this important question about the causes of leukemia. Yes, certainly there are some, predisposing factors that can actually increase the risk to leukemia. That's the 4 major types of leukemia we've discussed. So it's been noted that, lifestyle factors such as smoking. So some people are used to smoking tobacco, and these tobacco actually contains carcinogens such as benzene. Okay. Now, benzene has been identified by research as one of the known risk factors for leukemia. So especially this is linked to acute myeloid leukemia. So what would say is that smoking in some instances can increase the risk of various cancers, including leukemia, and sometimes by extension you could also suffer from lung cancer, which I'm sure in the next podcast we will discuss. We also identified that excessive alcohol consumption is also a predisposing factor. So the chronic use of alcohol can weaken your immune system and therefore increase your susceptibility to, leukemia and other infections as well. Obesity is also one of the key factors we should, be talking about, and there has been research that shows a direct linkage of obesity to, several types of cancer, including leukemia. So obesity comes with, associated risks such as chronic inflammation, insulin resistance, and also changes your hormone levels. So obesity can actually promote, cancer development. Then also unhealthy diet. So, poor dietary habits such as, consuming diet which is high, in saturated fats or red meats, or sometimes some processed foods can actually increase the risk of cancer, such as leukemia. Then lack of physical activity or exercise, that's quite important. Having a sedentary lifestyle where you do not exercise frequently can also be, a predisposing factor, or can actually increase the risk of cancer. Then exposure to environmental toxins, this is very critical. Sometimes we get to exposed by virtue of occupation, we get exposed to some pollutants such as chemicals or insecticides or pesticides. Now these also contains carcinogens which can actually trigger leukemia in individuals. So these are some of the lifestyle which could actually be a factor in causing leukemia. However, we also have some genetic predispositions, which is passed on from parents to their offspring, and one of the factors that can actually increase the risk of leukemia has to do with what we call the Down syndrome. Can actually increase leukemia. Then also when there are mutations in your gene, that's your DNA, so that's the primary function of life. If there are mutations in that, it can also predispose you to leukemia. Then exposure to radiation, so in terms of the ionization power of radiations can alter the functions of the cell and can increase cancer or lead to leukemia. Then in general, some chemicals when exposed to can also facilitate the development of leukemia, like gasoline, I've already mentioned, pesticides or insecticides. So these are some of the factors. But lastly, I'm going to talk about viral infections. So certain types of viruses can also cause leukemia. We have the human T cell leukemia virus, typically HTLV1, and also the Epstein-Barr virus, EPV, are known to be causes of leukemia. Then sometimes your immune system dysfunction or dysregulation can also increase the cases of leukemia.
Whoa, thank you very much. It sounds like our lifestyles generally contribute to our predisposition or our risks to getting this disease. So time is fast spent. I would like to ask Dr. Clemens what his views are as far as people protecting themselves from leukemia is concerned. How should we prevent this disease?
Thank you very much. So prevention, they say, is always better than cure. So I'm going to tackle this in, first of all, two angles. First, I'm going to look at the lifestyle aspect. So to control leukemia, one has to avoid the use of tobacco, or one has to quit smoking. Like we said, smoking exposes you to carcinogens such as benzene, which are typically related to acute myeloid leukemia. And also, I advise that the excessive intake of or consumption of alcohol be taken seriously. So you need to limit your intake of alcohol to prevent you from getting certain types of cancer and also getting leukemia. Then regular exercise is very important to maintain a healthy weight. Like we discussed, obesity is one of the predisposing factors to leukemia. Then, of course, you need to get the necessary vitamins, and nutrients to build your immune system. So having a balanced diet is one of the key strategies to preventing leukemia. Then I'd also say that you need to protect yourself from environmental toxins. So like pesticides, like insecticides, and all those toxic chemicals, you need to protect yourself from it. Use the right protective equipment like hand gloves and all those equipment. And also you need to protect yourself from harmful radiations, because these radiations can actually affect your system. And in some cases, getting vaccinated against the Epstein-Barr virus or the HTVL1, like I discussed, the human T cell leukemia virus, is also very important to to actually prevent leukemia disease.
Whoa, thanks very much, Dr. Clemens. It's been an exciting discussion. I wish we had time to discuss more of this, but in the next session we will dig deeper and talk more about other cancers and find a way of bringing treatment and prevention strategies together so we can prevent these diseases and make the world a better place. Once again, thank you for coming, Dr. Clemens.
Thanks for having me, Eric. And greetings to all your cherished listeners.
Thank you. Bye-bye. Okay, cherished listeners, that'll be it for today. Subscribe to the channel and send us in the comment section what you would like us to discuss so that we serve you better. Myself and my team, we say thank you very much for listening. It's Eric. See you later. Bye-bye.